This will be the 5th treatment onto the hand, and today the patient will be narrating this video. We're going to go down to 1 bar, 2000 shocks at 10 Hz. Just reset the shock counter. This new gel's a lot thicker.
It is good, isn't it? Right. It's my 4th session then, isn't it?
5th session.
5th session.
5th session. You ready?
Yeah.
How's that feel?
Much less painful. In fact, apart from that top section where the original injury was, it's just considerably less painful. There's a little bit left there, just there, at the heart of the injury. But we're talking 5% in terms of pain of what it used to be. Up the top end, and remember that was excruciating, I think, on the 2nd treatment. There's no pain there whatsoever.
That seemed to be the little lump on the end of one of the interossei, didn't it? But just into here still.
Very slightly. Also, in the early stages, you can almost feel the shockwave impacting against something hard. And now it feels as if it's just sort of passing through. That makes sense?
Yep. If there's no big lumps of scar tissue to bounce across, you won't get the same sensation.
Yeah.
You just won't feel the same sensation. It'll feel easier basically. But then again, the shockwave will be having a bit of a pain relieving effect anyway, so you would expect the pain to go down.
Can't believe that. That is just
very different.
Yeah. That's the best it's been. Or certainly the least painful. That's just very different.
It is true in what you've said. The space between the two metacarpals you can actually see now.
Yeah.
Whereas you couldn't originally. It was just full, and now you can actually see the gap between the two bones. So.
Well, bear in mind, I had quite a few sessions of massage, and it just wasn't shifting it at all.
Wasn't going.
It just wasn't. No matter how deep we got in, it just wasn't shifting it. And this has shifted it in 5 sessions.
Yeah, it's definitely made an impact on it. You can visually see the impact it's made on it, and I can tell the difference it's made in the pain, because even on the last session, you were moving your hands, you were twitching. It was just obviously a lot more painful than it is now.
That's very comfortable.
Yeah, and the first session. Ooh, I remember that first session.
I'll tell you now, it was very, very painful.
Yeah, very painful.
Short-lived, just for the 2000 shots, but it wasn't pleasant.
No, and that's what everybody says. Until you get on top of the problem, it's not a pleasant treatment to have particularly.
Yeah, even up there, there's very little left. And I can't hear any sort of changes in tone like it did when you hit the hard sections.
Yeah. Lovely.
Well, that's very comfortable.
It's definitely looking a lot better. I can see the gap in between the two bones, just as you can here, and just as you can here, you can see the gap. You can see there's still some just here, but it's nowhere near what it was. That was flat in between the two bones originally. You couldn't see this gap here at all, and now you can. So it's definitely removing it.
Well, I've got full movement now. Absolute full movement.
Your grip's better. When you grip, actually, you can still see it. It's just there. You can still just see the ridge of it.
Slight.
Yeah, it's still apparent.
But there's no pain on gripping at all now.
That's a lot better. But you just needs that bit knocking out of it.
Yeah.
Just needs that bit knocking out of it. But it's definitely getting there.
No, very happy. Very happy.
For an injury that's over a year old,
and wasn't going anywhere.
I don't think that's going too badly, really. I think that's a pretty good result so far.
Excellent.
Excellent.